Welcome to Winning Healthcare Food Fights Without the Mess. I'm Hunter Schultz, and this is the first show with video, and appropriate that it's part one of the 2020 Healthcare Buyer's Guide. Today, I'll explore coverage and care. I'll also tell you which one comes first and why. You'll also be able to amaze your friends by drawing a picture of healthcare, and you'll learn some pointed questions to ask your elected representatives and candidates. People toss trillions of dollars around like cupcakes. Here's a figure based on transparent online prices. $304 billion a year buys comprehensive primary care for all 329 million Americans. I'm talking care and not just coverage. I'll just let that sink in as we explore more in the guide. You'll understand more about what that care is too. By the end, you'll know what to look for. My dad once told me that communication is the root of most business problems. He was right then and now. With healthcare discussions, we don't see eye to eye with others. The reasons are many, but the solution is deceptively simple. Sadly, the word healthcare means many things to many people. I've watched conversations between American and Canadian or British expats about healthcare. Americans refer to how fast they get care, while Canadians would say they do too. Americans counter by saying Canadians now travel to the U.S. for their care. That's true, according to Dr. Keith Smith at the Surgery Center of Oklahoma. Many of his customers are Canadian and travel to his center because they cannot get their surgeries in a timely manner back home. Both sides can't be right, though. They are talking about two different things, as you'll come to appreciate. So now, when someone mentions healthcare, ask them which part of healthcare are you referring to. I usually get a puzzled look in return. You are probably wondering, too. You can't visualize it yet. Remember, the questions are always more important than the answers. How do you know you have great health care? That's a powerful question because people simply don't know what they don't know. Even wealthy people have a hard time with that question.
They've never had it, so they can't imagine it because they've never had it. They've been shipped out within 10 to 12 minutes or less, and they're frustrated. And if they went in with, let's say, something like some acid reflux, they were given a prescription for an acid blocker and sent home, which is fine. But if a little time had been spent, might have found out that there was something that they were eating on a regular basis they shouldn't be eating in their situation, and and a lot of things there might be on the cause side, and on the treatment side. A lot of lifestyle changes could make a huge difference, like cutting back on coffee, cutting back on alcohol, not going to bed until your dinner is digested, keeping the head of your bed elevated a little bit, because acid doesn't run uphill, it always runs downhill. These are all simple things, but there's no time for that. So I'll just give you the prescription, and sounds like I did pretty good medicine, but it's really not.
That was Dr. Stephen Schimpff confirming that people are clueless about great care's attributes. So they revert to some form of, I have a great health plan through work. It's all about the coverage. And it's the wrong conversation we should be having. A cardinal rule, coverage doesn't equal care. There are two components to any healthcare discussion. And it's vital to define and focus on one or the other, coverage or care. Thankfully, there's some big clues on which should come first. You don't buy a car or a home based on insurance coverage, do you? Most people don't think about insurance until later. In fact, the first question your insurance broker will ask is, what kind of car are you buying? You think of car insurance as reducing your financial risk in case of an accident, theft, liability. Fairly easy in that respect. You figure out the financial risk you're willing to assume with your deductible, and the policy is priced accordingly. The same should be applied to healthcare, but it doesn't. The system is rigged for getting coverage first and then sorting out care later, with copays, deductibles, and is my doctor in the network. In many ways, our current system works against us getting great care. Logically, we need to understand more about care and what that means. When you see the word car, almost immediately you have a mental image. You may envision potholes, maintenance, insurance, traffic jams, and buying fuel too. As a result, conversations about cars are easier because of the context surrounding them. Because of the healthcare businesses I was in, I needed to rapidly communicate what care is. Simply put, care is the delivery of medical goods and services. Here's a little exercise. Ask someone to draw a picture of healthcare. What do you think you'll see? More important, if 100 people did that, will the drawings be consistent? Visualizing care adds clarity and instantly refines healthcare conversations. Keep it simple and remember, there's majesty in simplicity. I finally found something so simple I could do it with my hands. But here's the healthcare picture I draw for people. Primary care is general health issues, mental health, medical questions, routine tests, checkups, and even many pre-existing and chronic care illnesses fit here. A surprising amount of urgent care needs, too. In our lifetime, about 80 to 85% of all of our health care is primary care. Primary care physicians connect our medical dots, or at least they're supposed to. All great care is built on primary care's foundation, assuming it's designed right to enable comprehensive care. Specialty care is where specialist practice and advanced diagnostic solutions reside. Specialized treatments, medications, and elements of urgent care not requiring emergency or inpatient care are here too. If the system is designed right, the need for these goods and services are reduced. Funny thing, it lowers overall healthcare spending. Catastrophic care includes what it sounds like: visiting a hospital for emergency care such as accidents, trauma, heart attack, stroke, or inpatient care such as cancer treatments and post-stroke rehabilitation taking months to relearn how to walk and talk. They are truly extraordinary medical events for most people. However, they garner the most media attention, don't they? Surprise bills, high deductibles, even higher premiums, medical debt, they all get eyeballs. It plays on basic fear of the unknown, and that's been driving insurance policy sales for many centuries now. It's understandable, though. The charges repeat. Charges keep going up. Costs, however, have remained relatively static. Interesting, isn't it? Surgery Center of Oklahoma posts their prices online, and they haven't gone up in 14 years. Why is that? The questions. But why focus on care first? We must get that right. If we don't, all the coverage in the world won't solve America's catastrophic primary care status. So now you have a picture of care, where things fit, and what you need to know more about. Comprehensive primary care. I mentioned in the preview episode about super users. They bounce between the upper two areas at a very high cost. So this hits home when you realize that a big chunk of their chronic care is easily handled with comprehensive primary care. With the care triangle now in your head, when I say dropping many chronic care patients into comprehensive primary care, you get it. It also reinforces the question, which part of care are you referring to? Recalling my expat friends, the Americans were referring to specialty care, which our system is focused on, while the Canadians were talking primary care, which all other developed world countries are focused on. Let's move on to coverage, otherwise known as paying the bill. There's an important point to make here. There's no such thing as free health care. It's paid for one way or another. To say otherwise is a lie and an insult to your intelligence. However, we need to get care right first. Then coverage becomes easier to figure out, and it will be far different from what we have now. However, for the moment, it's important to see the relationship to care. Here it is. The inverted triangle represents the proper view of coverage and the cost of care, coincidentally matching the rest of the developed world. Everyone but the U.S. focuses on primary care. That's a big clue, a big one. The pointed lower end shows the low cost of comprehensive primary care with rising costs along with care needs. That makes sense. It's logical regardless of the healthcare system. Americans are now more uncertain than ever about healthcare. They're frustrated to the point of giving up and letting someone else deal with it. Some are taking advantage of this by lumping all healthcare together, and thus all healthcare is too expensive and government should handle it. There's a high fear, uncertainty, and doubt, or FUD factor now. Yet, if Americans knew how great comprehensive primary care is, how it dramatically lowers overall costs, they might take a second look before surrendering their health care freedom. The system is the key. Complexity equals more cost. You want simplicity, period. Dr. Ken Fisher illustrates what's possible.
I would like to see a day whenever you saw a doctor, be it a family physician, general internist who is taking care of your overall health. And I believe it's critically important to have a person like that, a physician who you really trust, whose only function is to look out for your benefit, not working for an insurance company or a government agency or anybody else, but only works for you. That means you pay them cash out of your health savings account. And so any physician visit, any physician takes care of you in the hospital or ambulatory should be, in my opinion, paid cash from your health savings account.
Regardless of coverage type, think of it like car insurance. You cover the major losses, but pay out of pocket for routine things. Even if you could, you'd think twice about submitting routine car maintenance bills to your insurance company. Minor dents and scratches beg the question, if I do this often enough, will my premium go up if I submit this claim? Your insurance broker will tell you yes. Yet Americans routinely submit all types of minor claims to insurance, whether public or private. Why? The system says so. Dr. Melissa Jones of Priority Care gave a perfect example of how screwed up this is.
For one example of this is I had somebody, and she has insurance. She had her labs done with me. I think it was $6 for the initial workup. There was an abnormal lab value, and so I did some follow-up labs. It was standard of care, is what I would do with anyone that had the abnormal value. There was a mistake, and they went through her insurance, and I called later to find out how much they charged her. They charged her over $500, and then she has what she calls good insurance. So the good insurance paid over $400 of that, so her out-of-pocket cost was $70. So in her mind, the doctor ordered $500 worth of tests, right? So she has good insurance because it covered a lot of it. If she had just done cash pay with me, it would have been $10.
It's one reason for dramatically rising premiums and costs over the past few decades, plus a whole new level of administration burden. As Dr. Jones' patient discovered, the real cost of care is a lot lower than the charges. So instead of that nice pointed bottom, America's system looks more like this. It's bloated and wasteful with less focus on care and more on administrative burdens. including electronic health records and third-party payers. America's healthcare system uses a fee-for-service business model. Some form of coverage touches almost every aspect of it, reflecting its usage for the little things as you would never do with car maintenance. Fee-for-service also forces more overhead costs on primary care practices. Instead of a nice pointed cost triangle, America's healthcare system has a wider, more expensive bottom. Medicare, Medicaid, and private insurance also inflate usage of the upper two care areas. The care triangle shows primary care's diminishing role. If you've ever needed stitches on a Saturday evening, you would most likely go to an urgent care clinic or emergency department. If called, your physician's office voicemail would tell you, go to the emergency room anyway. Those same stitches would be a 10-minute procedure for any physician in the right system at far less cost. Unlike other developed world countries, our current healthcare system drives primary care upward and away from where it should be. Why? One reason is there's no time for patients, which we'll cover in Part 3. Another reason why we spend so much is our system, and it's been a slow-motion train wreck for over 50 years. Primary care's stable foundation is a shadow of its former self, where your family doctor knew you as a person, the whole you, where and how you live, work, and play. In short, there was a trusting relationship fostering better care. They helped you navigate the system because they had time to do so. Sadly, numerous changes to our system corrupted the relationship and prevents physicians from being able to give great care. And poor outcomes reflect it too. You're a number now. So in looking at any proposed plan, one of the first elements you should look for is the focus. Care or coverage? Does the plan gloss over care without going into details? That's a red warning flag if there ever was one. The devil's in the details. It's time to ask some pointed questions in those town halls. By the time you're done with this guide, you'll have plenty. Another element to look for is how payments are structured. Same as our current fee-for-service system, the one requiring massive amounts of administrative burdens on doctors and providers. Where will the price transparency come from? How will we know we are getting the value we should rightfully expect? Who's going to audit those provider payments? How much access will government have into our personal health records to justify those payments? This is crucial, as you'll see in Part 4. In one episode, Dr. Ken Fisher and I explored health savings accounts, and he said something I think is quite telling.
If you're an insurance company, your margins are pretty low. So their profit's about 2, 3, 4%. So the way to build more profit is you need a much bigger gross. The way to have a bigger gross is to be in charge of everything. So every time you see a doctor, they say, okay, well, we'll pay for it. Every time you get expensive a medicine, we'll pay for it. So that tremendously increases their gross. So it's really not insurance. Insurance is something that, like your automobile insurance, your car gets wrecked, they pay. So it's a catastrophic event. But car insurance doesn't pay for gasoline, doesn't pay for tires, doesn't pay for upkeep. So they changed the idea of health insurance to actually be prepaid health care. So it is in their interest to say to the American public, we will manage your care. We will take care of you. They even spread the word that, if you're in charge of your own money in a health savings account, you may not want to use that money for health care. because you'll want it to accumulate over years, which is one of the advantages of health savings accounts versus health reimbursement accounts. So they spread this word that you are really incapable of managing your own care. We'll do it for you at great cost. And so you have this tug of war that it's in an industry's interest to convince the American public that the individual is unable to direct their own care, which, of course, is an absurdity.
HSAs are now more common in the U.S., and some accounts are free from monthly charges. But HSAs are hamstrung by needless government rules preventing them from reaching their true value. It's one of the few 800-pound gorillas in the room, but currently it's in a straitjacket. As Dr. Fisher explained,
most employers are paying about $20,000 to $22,000 a year for a family of four's health insurance. That's $22,000 pre-tax. That really is salary not being paid to that individual. So let's just say that individual decided to go the HSA route. That would cost about, between having cash to take care of the family and buying a catastrophic policy, would cost about $10,000. Wait a second now. That means if the employer, Ford Motor Company, gave the employee $10,000, $12,000 into their health savings account, take care of the family, the employee now could get the $8,000, $10,000 more in salary. That would be taxed. So the government, the federal government would benefit, the individual would benefit, the loser is the third-party insurance company.
With huge lobbying.
So who is paying a fortune to maintain a system that is costing the employee another $10,000 a year in salary. And by the way, this increase in healthcare premiums to subsidize Medicare and Medicaid and the inefficiency in the system because of the bureaucracy is the major reason why salaries have not kept up with cost of living. And the government would also recoup tax money.
You'd probably they'd gain more in taxes because you're unleashing.
That's right.
You're unleashing the private market.
And you're giving the employee about $10,000 more in salary.
If you get primary care right, and you'll know how to do that over the next few episodes, it makes everything else much easier, including coverage, which I'll return to. The questions are, what types of care need insurance? And where do HSAs fit in? You need to know more about care first. In the next 3 parts, I'll explore more about comprehensive primary care's attributes. Knowing what great care is will help you make a better voting choice in November. I've included many reference links in the description. Thanks again for joining me, and please do share your thoughts below. Until next time, there you are.